We're about to go live. Okay. Hello, we're streaming live on Facebook. This is a Zoom Facebook Live event with the Hospitals of Providence. And today with me, I have Dr. Gustavo Martel, who is our Chief Medical Officer, and Dr. Alvaro Hernandez, who is our Chief of Staff. We're going to be talking today about OR safety guidelines as well as just hospital safety guidelines in terms of, is it safe for you to visit the Hospitals of Providence? What protocols are in place for you and your family, your loved ones, as well as for the staff that work within the hospital. So we'll start off by just having a brief introduction. Dr. Martel, how are you today?
I am doing well. Thank you very much for having me on here and giving me the opportunity.
And your role, sir, in the Hospitals of Providence?
Correct. So for the past 3 years, I've been the Chief Medical Officer at the Trans Mountain campus for the Hospitals of Providence. And so my duties typically are for patient safety, risk management, medical staff office issues, and I spent 26 years practicing obstetrics and gynecology.
Okay, thank you. And Dr. Alvaro Hernandez, thank you for joining us as well. It looks like you came from surgery.
I just finished a couple of surgeries this morning.
Great, well, thank you. And Doctor, your role at the Hospitals of Providence?
I'm an orthopedic surgeon, currently Chief of Staff at the Sierra campus, and also Chairman of the governing board for both the Memorial and Sierra campuses.
Great, thank you. So let's start off with you, Dr. Martel. Is it safe for a patient to come to the Hospitals of Providence for a surgical procedure?
Good question. I think that routinely it would be considered because of the atmosphere with COVID-19 that it is not, but tremendously improvements have been made in the hospitals from the time you enter the door to the time you have your surgery and to the time you're actually discharged. The answer is an unequivocal absolutely. Probably no better time than the present. It's very, very safe. Like I said, from the time you enter the hospital premises to the time you're discharged, there's many, many policies, procedures, and practices that have been put in place, particularly for not only for the safety of the patient, but the safety of the physicians, the staff, all the employees within the actual hospital.
So let's talk about some of those safety protocols that have been put in place. Can you mention a few?
Sure. So you walk into the hospital, you're asked a series of questions. I want to say there's like 9 or 10 questions you're asked. And then if you do not have a mask on, they're going to actually place a mask on you, or they're going to ask you to place a mask on yourself. And then from there, you're escorted up to, say, the hospital, to the perioperative area where you're going to be in a private room. And then the nurses, everybody has the appropriate PPE necessary to engage you. Once that's done, if you will wind up having to have the operation after being screened again on the floor, then you go into a room. Particular practices are put in place where the anesthesiologist and his assistant, his or her assistant, will proceed to intubate you, which is what the anesthesiologist is going to do. They use a particular, like a plexiglass system where it kind of limits the amount of exposure and secretions and stuff that they come in contact with. And then the other thing is that everybody else leaves the room in order to accomplish that. It's not until there's safety within the environment that they allow the surgical team to come back into the actual operating room. So then you come out of the operating room, you have a mask placed on you again, for the most part, and then you are again in another private room. And then you're actually, if it's an outpatient procedure, reunited with your family, who for the most part will be waiting for you outdoors. And if not in their cars or somewhere outdoors, then they wait for you independently in the waiting area, making sure that social distancing is practiced as well, because there's not very many people we're allowing in at any point in time. But obviously, if you have an 80-year-old mother that you've got to pick up, then you're going to probably join her, pick her up, and then leave the hospital, by her side. So many, many tools, many practices, many policies, many procedures that are put in place for the purposes of the safety of everyone involved in the care.
And you captured a lot there in that conversation. So let's back up a little. You mentioned it's going to be, you're going to be seeing everybody at the hospital wearing protective equipment when you walk in. And that's a very good sign. That means everyone is taking the most safety precautions as possible. And if you don't have a mask with you when you are about to enter the hospital, then they will provide one for you.
That is correct.
Is there a separate entrance for patients that are going to go into a surgical procedure?
We have only, that's a very good point. We have two access points to our hospital. One is through the emergency room and one is through the front door. So patients typically preoperatively come in, and whether they have COVID or not is something that has to be established well in advance. If you are identified as an individual who does have COVID, you will be brought in through a third entrance. It is typically through the ER and cared for in that manner. But we only have 2 points of entrance right now, and at both points of entrance, there are individuals literally monitoring those entrances and asking those questions and making sure you do not go into the hospital without passing a screening exam as well as having a mask on you. So even if you do have COVID and you have a mask on you, remember, it is your secretion that would be spilling out that would be infecting other people. So if you have a mask in place, you're literally taking the right precautions to not expose others.
So we mentioned patients who have been screened or who have COVID. So do you typically need to get tested for COVID prior to a surgical procedure?
You are screened, and it's always up to the physician if he feels that above and beyond that doubt, that he feels that that patient is a patient of interest. The answer is yes, we typically do run those tests. However, if I were to go to surgery, you to go to surgery, there's a high likelihood that we would not be tested because we would probably be screened negative. And not everybody who's having surgery, it has to have that test. Now, I think they're moving in the direction when we have enough reagents and resources to do everybody, because remember, we have a lot of hospitals. But at the present time, it's based on screening, it's based on what the physician wants for that particular patient.
Okay. What about imaging, labs, pre-testing prior to surgery? Can that all be done in the hospital?
Yes, it can. It's critical that somebody preoperatively that's going to be operated on has the appropriate lab tests, chemistries, the appropriate x-rays that are necessary. As Dr. Hernandez will probably let you know later, I mean, I'm sure he probably has those x-rays up in his room while he's operating to see what he's actually, what he needs to do to perfect his surgery. So yes, all those ancillary services are open. And again, the same precautions are practiced with those individuals. If they come into the hospital, they will have a mask on, they will be screened appropriately, and the individuals who come in contact and engage those patients preoperatively will also have all the protective equipment that they require, pending the results of that patient or the risk of that patient.
Okay. And let's say a patient goes through all of the protocols that you just mentioned. They've been pre-screened, they are not COVID positive, but the day of the surgery, the patient is just not feeling well. What should they do?
Very interesting question, and we do have a solution for that as well. So typically we start contacting those individuals 7 days out from their surgery. So we contact them and ask them the screening questions. 3 days out, we ask them those same questions. The day of surgery, they're going to be asked those questions on the way in, and they're going to be asked those questions in the preoperative area. If they screen negative at any point in time, there's a high likelihood that those individuals are going to be canceled and potentially put in a different pile of individuals, such as if you are a person of interest, they may send you down to the ER if they feel that you are actually a patient of interest and test you in that manner. But we do screen them at 7 days, 3 days, and on the actual day of surgery.
Okay. And if you do have a patient that tests positive for COVID, what is a separation of COVID and non-COVID patients at the hospital mean?
Correct. So we do have what we call a quote COVID unit that is specifically for only COVID patients. And we separate them by 2 floors, all the post-operative patients who do not have COVID. So there's a tremendous distance between them, even when they actually recover. In the recovery area, we identify those individuals, and then we leave beds on the side of each. So there's empty beds on each side of those individuals, and then they are taken to a particular unit that we have designated a COVID unit. Going forward with that, even giving a little bit more information is, even the nurses are not going to go to different units if they've been working on the COVID unit. So we relegate them to the COVID unit so that they also don't cross-contaminate any of the other floors. So we've gone to that extent as well. And they are labeled, not in a bad way, but labeled so that everybody knows that they're coming in contact with a COVID patient.
Okay. And I think it's also worth noting that all of the processes, procedures, safety measures that you've mentioned are market-wide. So they are in place for all of the hospitals of Providence. That includes Trans Mountain, Sierra Memorial, East Campus.
You are correct. And not only that, they're consistent with CMS guidelines and the county guidelines. There's no doubt that we're following all the guidelines necessary and going above and beyond that to do some additional measures that we're taking for the safety of not only the patient, but all the staff, the doctors, and the nurses.
Great. Thank you, Dr. Martel. Now, Dr. Hernandez, we're now going to switch over to precautions in the OR room. Are there additional safety precautions that you are taking in the OR and that you see the hospital and your staff taking for surgical patients?
Absolutely. Initially when the stay-at-home orders came out, we pretty much stopped all of elective surgery for about a 4-week period, and we started back doing elective surgery a couple of weeks ago. But the thing that's changed is, number one, we're not quite running at 100% capacity. And part of the reason is so that we're not overcrowding the operating room, overcrowding areas where patients are in holding. One of the things that we do now is that when the patient comes into the hospital for their surgery, and they're taking a patient holding, they're in a room by themselves now. They're wearing protective equipment and face masks in order to protect themselves and the staff and other patients. So we're not, we've really separated. The patients are not as close as they were. And also the operating rooms, we're taking great care that all the people in the operating room are wearing protective equipment. We're taking care when patients are intubated, patients are taken to recovery room and up to the room. So it's really a very safe thing. And I think some of the people that come to the hospital kind of get a little afraid when they see everybody wearing a mask and everybody wearing gloves. They kind of get this idea that, oh my God, this must be a contaminated place, but this really isn't. This is a very safe place for us to be. And it's just, we're going above and beyond to keep it as safe and as for not only us, but for the patients. So I really want to stress that I think right now elective surgery is very safe with all the precautions we're taking.
And what about the process of being able to speak to your surgeon prior to surgery and after the surgical procedure?
We still do that. One of the things we do, since there's really patients are now being brought to the operating room by themselves, typically in the past, they may have had one or two family members with them. Now, patients are being brought into the hospital. Other family members aren't really allowed to come in with them. So they're brought to patient holding. When they get to patient holding, their surgeon is still coming in. We still examining patients. We're talking to them. We're answering any last minute questions. We're marking the surgical site to make sure we're doing the correct operation on the correct patient. At that time, we also, when the patient is taken back to the operating room, we're having nurses notify the family that, okay, you dropped your dad off an hour and a half ago, but we want you to know he's just now going into the operating room. So they're not there just sitting around thinking, oh my God, he's been in surgery for 5 hours. So we're letting them know when they go back. And we are seeing the patient in the holding area before they go back. After the surgery, then we notify the family member. We get a phone number of who we can contact. I typically call the patient's family and say, hey, this is Dr. Hernandez. The surgery's over. Everything went fine. Your dad's in recovery room. He's going to be here for an hour and a half or so. And then once they get to the floor, we also have the nurses notify the family then. So now they know that they're upstairs and everything's going okay. So we're doing everything we can to include the family, even though they can't actually have the direct contact with the patient.
Right. So even though the family can't necessarily visit or be with the patient during the entire process, there's continuous communication with the family member.
Absolutely. We're trying to make them as comfortable as possible too.
What about with the patient? How does the patient communicate with the family member while they're in recovery?
Well, typically patients don't really talk to family members much at all in recovery. Typically don't let family members into recovery because there's several patients being recovered and there's a lot going on. So we usually don't have family members in there. But once that they are out of the recovery room into their room, that they can communicate by phone or with their family.
Okay. Some patients have been worried, as you mentioned, about coming into the hospital, and they've postponed some of their surgical procedures. What's the danger in doing that, in postponing what are the potential dangers in postponing medical procedures for that patient's health?
Well, we started postponing procedures, like in my particular field, I'm an orthopedic surgeon. We stopped doing joint replacements, hip replacements, knee replacements. And there's a lot of people out there suffering and that can hardly walk that really need the procedure. And some of the general surgeons were holding off with some procedures like for cancer and things that weren't absolutely an emergency that could wait a week or two. But there's all kinds of issues that patients have that need to be treated. But I think that we're really at a point now where it's safe, and patients need to continue to take care of themselves. My office, I can tell you, the last few days has started to get back to what I would call a normal office. I'm starting to see the volume of patients that I was seeing before the COVID outbreak and pandemic, but we're still doing all kinds of precautions there like we are at the hospital, and the patients are now coming in and take care of themselves where they were putting things off.
Great. So we're sort of transitioning into the new normal.
Right, and I think that's what it's going to take a while for people to understand. And again, I want to stress the fact that just because you see us walking around in masks and gloves, and we have people taking your temperature when you walk in the hospital and asking you questions, it's not because we're full of sick patients in the hospital. We're just trying to make sure that we don't get in the hospital. And the hospital, I tell you, is probably one of the safest places to be.
Right. Safety precautions. Well, thank you both very much. I hope this was an informative episode for you all. Thank you for joining us. And please stay tuned for additional seminars and live interviews coming up. If you have any questions, please let us know, chat with us, send us a message. And also, please be safe and take care of each other. Thanks again. We'll talk soon.
Thank you.